Hello, I'm Dr. López here at Olean Dental, and today I want to answer some of the most common questions about bad breath. So, what is bad breath and how is it defined clinically? Well, bad breath or halitosis is when you have a bad odor that comes from your mouth. It could be something temporary or occasionally, or it could be something that is happening on an ongoing basis. Then, what would be the most common causes of bad breath? Well, sometimes some food that you eat, sometimes uh, tobacco, smoking, alcohol, that kind of stuff could cause some bad breath. But sometimes it's something worse than that. Things like decay, infection, abscess, dry mouth, or problems on your sinus could create bad breath. So, what is halitosis and how is it different from occasional bad breath? Halitosis is the medical term to describe chronic or ongoing bad breath, whereas bad breath could be just a temporary thing based on something temporary that you put in your mouth and it causes bad breath, bad smell, but it could go away. Whereas the halitosis is something a little bit deeper, something a little bit worse that needs to be treated in a different way. Another important thing is, can cavities or tooth decay cause bad breath? And the answer is absolutely yes. Cavities, not only by themselves is decay of the tooth, basically the tooth is rotten, but also that decay creates space where food can get stuck, and all of that food stuck in there is going to decompose, and it's obviously going to create that bad breath. Sometimes some people wonder if can wisdom teeth contribute to bad breath. The wisdom tooth in and itself will not cause bad breath, but most of the time the wisdom tooth comes in an angle. We call that an impacted, meaning instead of coming straight, it's coming in a different direction, and then there's a lot of gums covering the tooth. Something that happens very often is underneath that gum, you get a lot of food and a lot of bacteria trapped in there, and the decomposition of that food can create an infection on that area, and that could cause a lot of bad breath. Something people sometimes wonder is if it's normal to have bad breath after a tooth extraction. It could be a temporary thing because obviously once you take a tooth out there will be blood and the body's healing and all of that, but not quite as much. It could happen, but sometimes it's more related with people smoking and getting dry socket or any other complications after the extraction, and again all of that could create the bad breath. Another important thing that people wonder is, what are some signs that bad breath may be chronic versus occasional? Well, it has to do with the fact that sometimes you brush your teeth and you use mouthwashes and you do everything you think you can, but still the bad breath doesn't go away. This is very common with people who have gum disease, because when you brush and you use these rinses, you can only clean above the gum line. But sometimes, and this is very common, people with problems on their gums and the bone, you have bacteria deep inside the gums that no matter how hard you try to brush, it's not gonna go away. Then from the inside of your gum, all of that bacteria is creating some toxins and is creating some problems that will just not go away. It doesn't matter how hard you try brushing or flossing. Something that people wonders a lot is what dental treatments are available for bad breath. The first and most important thing is to determine what is causing bad breath. Like I said before, it could be dry mouth, but it could be decay, or it could be problems on your gums. And again, once you have those problems, you're not going to be able to take care of them by yourself. So sometimes, in order to take care of that halitosis, of that chronic, long-lasting bad breath, you need to take care of whatever is causing it. It could be like if you have decay, you need to get rid of all of that decay. You need to make sure that your teeth are touching each other so the food doesn't get stuck in there. If you have gum disease or bone disease, you have that infection deep inside your gum, you may need a deep cleaning as the only way to really remove all of that bacteria, all of those toxins, and everything that is causing the bad breath. So, in other words, sometimes you can fix it yourself, but if it's something that is ongoing and it's been there for a while, more than likely you're not going to be able to take care of it on your own. You're going to need a professional to treat the underlying, meaning the real reason why this is happening. So another question would be, what kind of toothpaste and mouthwash do we recommend for bad breath? The most important thing is it has to be antibacterial. and that mouthwash should be alcohol free. Also, some components like zinc could help with the smell in on itself. As far as the toothpaste, what's really important is how often you brush and for how long. So when you're brushing your teeth, it's not just about putting that toothpaste on the toothbrush, creating a foam in there for 10 seconds and then spitting it out and thinking that you brush your teeth. It doesn't work like that. You have to spend a little longer cleaning all of the surfaces, and the toothpaste helps because it creates that antibacterial that goes all around the teeth, but you need to spend enough time with that inside your mouth. That's why you need to brush for 2 minutes. Are there some home remedies that could help reduce bad breath? Well, again, the most important thing that you can do at home on an ongoing basis is both brushing and flossing. When you brush and you floss, you remove 90% of all of the bacteria and everything in your mouth. So that's the biggest bulk of the battle. You have to make sure that you put a toothbrush in there at least twice a day for at least 2 minutes. You also need to floss at least once a day. If you could do more, even better. And the other thing that helps are mouthwashes, alcohol free, and sometimes gums with no sugar. That could also help with the odor, with the bad breath from your mouth. How can someone tell if they have bad breath? This is really interesting because sometimes if you have bad breath, you more than likely are not going to be able to tell by yourself because your sense of smell gets used to it. So sometimes you have to ask somebody else, which could be a little tricky because it's hey, smell this. Is that bad? It could be a little bit, not everybody will feel comfortable with it. But it's important to understand that sometimes you don't even know if you have it. Something that can be done is you can ask somebody else if they smell the bad breath. And something that may work is if you use your tongue and you lick on something and then you let that dry and then you smell that something. It could give you an idea if there is a really strong smell coming from your mouth. Is it possible to get rid of bad breath permanently? And the answer is yes. The mouth should not smell bad, especially not on an ongoing basis. So if you eat something bad, it may smell bad for a little bit, but it should go away. The solution to this problem is to have your dentist check your mouth and make sure you have no disease. Because what causes the bad breath ultimately is the bacteria and the disease, meaning the decay or the problems on your gums. But once you take care of those, once you take care of all of your decay, once you remove all of the broken teeth, when you remove all of the infection, and once you do those deep cleanings, your mouth is going to be in a stable position, a stable place where there will be no more bad breath coming from your mouth. Okay, so I hope I was able to answer the most common questions about bad breath. But if you have any other questions, please feel free to reach at us here at Olean Dental Studio. We'll be more than happy to answer any of your questions. Also, if you want an exam, we have a great team of people and doctors and everyone who'll be more than happy to assist you, whether you have any concerns or questions about your bad breath or anything else. Thank you so much.